Hi, my name is Dr. Jamie Fleming. I am a pediatric anesthesiologist and interventional pain specialist at Phoenix Children's Hospital. I'm currently the section chief for the pain section, and I'm double board certified in both pain and anesthesia. One important thing about emphasizing all of these other therapies before opioids is that opioid sparing does not mean under treating pain. So that's a very important thing to distinguish. And very rarely are opioids a part of our pain treatment protocol. Sometimes we have families come in that really say, we just want something to take the pain away. And that's something we hear frequently because it's such a difficult and frustrating experience for the families. And they're just, feeling helpless, not being able to treat their child's pain. And we really understand and hear that. I think the thing for families and also practitioners to know is that really that's not going to be the magic bullet for their pain. We can't really take it away with just one modality. We really need to integrate all of these things to best address all the things that influence their nervous system and how it's processing pain. It's very uncommon to really get optimal results with just a medication or just injection. Really, those things help build on a bigger foundation of multidisciplinary care. And, really for each patient, we really have to understand their internal and external environment and really customize and optimize based on those factors. And, one thing that's really fortunate about being at PCH is that our philosophy around pain is early prevention and early treatment. And oftentimes this goes far before they ever reach our pain clinic. And one example of this is in our surgical services. A lot of our surgeons will recognize risk factors when they're assessing patients for surgery, and they'll end up sending those patients to our pain clinic preemptively for us to see them, evaluate them, come up with a pain treatment plan around their surgery, and also educate those patients on what to expect and how to dial into their nervous system to improve the pain that they will experience with surgery. In addition, we have a very robust anesthesia service with regional anesthesia. And by that, I mean things like nerve blocks, nerve catheters, also even epidurals and things like that to help minimize strong medications needed for surgery and help with pain around the time of surgery. And when you combine all of these things, it really matters because severe acute postoperative pain is a big risk factor for persistent chronic pain. So we're really fortunate to be in a system where we can work on preventing those things early. And when we look at lessons for our pediatric colleagues, I think there's several main points, and one of those is believe the child and validate their pain. And I would say that's the single most important thing. Beyond that, trying to encourage the patient to stay connected to school and social activities is really big. When they start avoiding those things, it often reinforces the pain cycle and makes it worse. We want to avoid prolonged rest. So things like physical therapy are important. And sometimes in acute situations, you may need rest, but chronic pain is a different story. And so we encourage gradual return to activity. Very important to screen for sleep problems, mood problems, also other stressors at home or school, because that will influence the way that they're experiencing pain. And then importantly, refer to physical therapy and psychology early, refer to your pain program early, and finally set the expectation that to the patient and their family that they won't have zero pain, and that's not the goal. The goal is getting back to living life.